I graduated from college in 2000, spent the summer racing sailboats, and then thought I might try to be a professional sailor and spend time down in the Keys and in Miami and that the winter of '01. And then very quickly figured out that the retirement plan in professional sailing wasn't great. And if you like living out of a suitcase, it's certainly an adventure. But if you're looking to start building something and put down roots, that's a challenging way to make it go. So long story short, in the fall of 2001, the gentleman that I'd known for a number of years said, "Hey, if you want to try to sell insurance, I'll pay a very small amount. And you can have at it." And been at it ever since. And so it was a good opportunity that I was given for sure. And ultimately,
That doesn't sound very appealing, Mike. If you want to try to sell insurance, I'll pay you a very small amount.
23 grand. I don't know. That wasn't, I mean, it was enough to,
Yeah. No, but the way that you phrased it, I just had a chuckle because it's just like, and you signed up for that.
Absolutely. And that was the thing that, I knew that I could bring something to the table. And what I had been doing was sending out resumes and, go and talk to Manpower, trying to find a job and Discount Computer Warehouse wouldn't call me back. And they want to, just the types of jobs, if somebody did call me back, were very unappealing. And I knew that I was going to have to just kind of, is more like getting coffee for people like on Capitol Hill. So
Right.
The thing about the insurance industry is that hard work is rewarded relatively quickly. It still takes time and you've got to really,
Sure.
put your nose to the grindstone, but ultimately you control your own destiny, and your success and your rising up the ranks certainly is on your timeline more than waiting for someone to do it for you.
So what you're describing then is that was kind of a base salary. That wasn't a cap, right? There was the opportunity to do well and earn more. I'm sure that's what you found appealing.
Correct. Right. So, here you get this amount of money for this period of time, and after that it's sink or swim. Manage to swim.
And so this is a traditional insurance agency, I'm guessing, primarily, rooted as a traditional health insurance and employee benefits broker. I'm guessing, you correct me if I'm wrong, but, doing the typical stuff that status quo brokers do, and spreadsheeting and comparing various carriers at time of renewal. What was your indoctrination like? What did you do and what did you learn there?
I think your assessment is fair. But if you think back to 2001, we were quoting plans with $100 deductible and $5 office visit copays, and the reality that we live in today wasn't on the horizon. And so this is how the business is done. And it was a lot like quoting all other insurances. So I learned a lot. It was nothing negative to say.
Yeah.
Yeah.
Yeah, no, I'm not digging for dirt. I'm really more interested in, I never worked at a traditional insurance brokerage. So my experience comes from the voluntary side of the business, and I supported brokers. So I, worked shoulder to shoulder with them across hundreds of open enrollments and heard their spiels and their presentations to employees over and over and over again. And the striking thing is, from broker to broker, it didn't really change much. It was all pretty much the same dog and pony show, if you will. And so it's not I'm sure you have, great respect and admiration from the guy that first employed you, that you sailed with, and all of that stuff. I'm not on a witch hunt. I'm just trying to figure out, like, hey, what was that experience like? What was your day-to-day like? Did you love it right out of the gate? I'm sure you had good days and bad days like we all do, right? But what was it that excited you about being there?
Appreciate the question very much. Your background is interesting to me too, because, I only had one data point, right? It was the environment that I was in, and I thought this is how it always is. And so I'm in my third professional stop now, 4 years later, and still, again, my data points are limited. Where I assume this is how everybody does it or how it's always been done. So we're learning as we go. But I guess the thing that what I love about what we do, and the reason I'm still in this industry after having turning 40 in 2017 and having the opportunity to kind of reassess where I was headed professionally due to a partnership self-destructed, unfortunately. But what I have loved, always do love, is the fact that I love entrepreneurs. I love being able to see unique businesses, how business owners have built what they've built, how they operate on the inside, and being able to be a small part of helping them be successful. That, I've always admired entrepreneurs, from the time that I became aware that they existed. And, the people that my parents associated with, the ones that own businesses, I was always intrigued to know more. And so that's what I love about what we do, is that we get to help support the work that other job creators are doing, other business owners are doing, and to the degree we can contribute to their success, it feels great. And that's what I love about what you're working on now and I'm working on now, is trying to figure out how do we clearly fix what is clearly a broken system, that if we figure out the secret sauce, and the way to do that is that we can put more resources in the hands of these job creators to go out and do more. So that's why I'm still in the industry.
Yeah. No, I think we definitely are kindred spirits in that regard. We're entrepreneurs through and through. And your process, I'm curious to know about your process, and I'll share mine. I mean, my approach is really to be an independent third party who sits on the employer side of the table, so my client side of the table, to look at and assess the healthcare landscape and help them appreciate what their risk might be, and help them evaluate a number of different strategies that they may have never considered. They may have heard of some of them. Typically, they haven't heard of all of them. But the objective is to really give them a sense of control and a feeling of control, because truly they have control. It's just a matter of whether or not they're gonna grab the brass ring and take control, or continue to do things as they always have. So I think my question really boils down to, in terms of your processes and your methodology. And look, folks, there's a myriad of brokers and consultants out there. Many of them lean towards status quo ways, but they kind of dabble in some, I guess, for lack of a better word, non-traditional types of strategies. Others have, a blend of both. They're fully insured. They're dabbling with custom plans and level funded. And then you have other folks that are on the extreme other side of the spectrum, and they won't even entertain doing a fully insured BUCA, Blue Cross, United, Cigna style plan. It is kind of the antithesis to what they are and represent. I can tell you that my approach really as a consultant is to, I do my best. I definitely do have an opinion, and I do tend to be partial, full disclosure. But I also, our approach at least, is to meet a client where they are. And so I'm not one that's gonna, try to shove something down someone's throat. It's like not what we do. If someone is, and I have clients that are fully insured with BUCA plans, I've discussed other options with them, but that's where they want to be. It's a fit for them. And I'm curious, I don't know if you're kind of, you fall in line with the ideology that I just laid out, or you're at one extreme or the other. What's your approach? How do you tackle it?
Great question. So we have clients that are fully insured with carriers because that's the right place for them to be. We have large clients that are self-insured but use a carrier model because, again, that's the right place for them to be. And then we have clients that have chosen to choose their own adventure and go down on a wild adventure with us.